You know, balloon sinuplasty is a safe and effective sinus procedure for those seeking relief from uncomfortable sinus pain symptoms. And here to tell us more, Dr. Andy Shaw with the American Sinus Institute. Welcome, Doc.
Thank you, Jeff, for having us. Good to see you, sir.
It's good to see you. You've been in San Antonio for about 6 years now,
yes,
and you know we have lots of cedar fever, and we have allergies, and we got things that'll crawl up into your sinuses and just make your life miserable. What kind of symptoms are we talking about?
You know, a lot of the things, facial pain, pressure, chronic fatigue, you know, people don't always recognize. Your body's just spending so much energy trying to fight the sinus infection that you're just so exhausted you can't make it through the day. So congestion. Headaches, absolutely.
Not being able to sleep.
Not being able to sleep.
Just constant pain. And if you've gone through the Z-Packs and you've gone through the Claritin, I mean, you sit there and you take everything over the counter you can find.
Polypharmacy, right. And so our goal is to kind of move people, you know, towards something that's going to be a little bit more definitive than just going to the pharmacy every so often.
So how does the balloon sinuplasty technique work?
Well, it's a nice step forward in sinus procedures. Instead of the more traditional surgery with the drills and taking out tissue, we're just using a balloon to open the natural ostium of the sinus, and it's really a nice step forward in sinus procedures.
It's really pretty simple, too, because I've seen people, I've been there at the office, I've seen several people to get it done within like 20 minutes. And you're basically compressing and opening up the interstate, if you will, to let air flow.
We're plumbers in a way. We're unclogging the pipes and enhancing flow and drainage, yes.
So I've seen it done within like 17 minutes, and people, after years of suffering.
Outpatient procedure, we can do it now in the office, but we have all of the equipment. We have anesthesia providers so that the patient has a safe, comfortable, pleasant experience.
Very simple, and you make them feel really good about it. And obviously, you can come to the office there at American Sinus, and you can, and obviously you can do the CAT scan and
absolutely
check all that.
And I think the patients like that. Instead of bouncing around trying to get their imaging, we can just do it right there.
So who's a good candidate for this?
Really, we would encourage patients who are having some of those symptoms you and I just talked about to come in and get evaluated. There's a perception that you kind of have to go through your primary care doctor. We would encourage, you know, the primary care doctors, great doctors, diabetes, heart disease. They may not have the technology or the equipment to diagnose sinus disease as well as we can, the subspecialists. So I would say anyone having those symptoms you and I just talked about is a potentially should come in and get checked out.
I've seen people over the age of 70 have it done, and I've seen 20-year-olds.
I think our spectrum is age 8 to as young as 92.
Okay. I think that's in a Christmas song, from 1 to 92.
Yes.
So balloon sinuplasty, the Enrubia technique, and of course it is 210-BALLOON is the phone number, 225-5666, AmericanSinus.com. And Doc, you're so calm and so just chill, man. I mean, that's the way life should be.
I completely agree. It's San Antonio.
People should feel good, and you can help them do that. Thank you so much.
Thanks,
for being
Jeff.
here today.
Thanks for having us.
American Sinus. All right, coming up on SA Live, we're going to